Let's get started with acne solutions and clarifying the skin. So, a couple of things as we start to roll into springtime and the weather is changing almost on a daily basis, at least where I live. There's some things that we want to remember in regards to our acne clientele. We want to remember with a 3-step solution to achieve success when we are looking at our acne clients. We know that acne never goes away. It is a genetic disease of the follicle that can be managed very properly but never cured. And therefore, we want to make sure that we are addressing it daily with home care with our clients. This is where it is so very important for you, the esthetician, the skincare professional, to make sure that you are educating your client properly and letting them know the importance of that daily home care routine. We also like to encourage those at-home skin treatments. I don't know for any of you that have had the opportunity to try Lira's brand new Pro Anti-Aging Pads, but these are absolutely amazing for acne as well. They work absolutely fabulous for anti-aging, for pigment, but acne clients also really like the simplicity of that product. And these work very, very well as an at-home treatment that your acne clients can use 2 to 3 times a week. And of course, we also want to make sure that we are combating on a clinical level all of our clients' acne needs. This is where regular treatments and having those clients come in on a regular basis every 4 to 6 weeks is super essential to making sure that their skin maintains that clarified, clear, beautiful look that they are expecting. When that clinical routine of them coming in and receiving treatments is tripped up, that's where a lot of the times where their skin will slip and they might start to have increased breakouts depending upon how sensitive the balance is in regards to their actual acne condition. So when we look at our 3-step solutions, once again, we want to keep in mind that our clients should be on daily home care, having an at-home treatment therapy 2 to 3 times a week, and also coming into clinic to seeing you about every 4 to 6 weeks. With that, we take a 3-step approach to acne, as we know that there are 3 items that have to be in our follicle in order to have that acneic environment. We look towards bacteria, dead skin cells, or corneocytes, and the excess production of oil from that sebaceous gland. So to achieve that success with the skin, we have to address every single one of those residents within that actual follicle. We want to make sure that we are balancing the skin, keeping that healthy balance of the good and bad bacteria on the skin's microbiome. We want to make sure that we do have an active and healthy microbiome on the surface of the skin. This is where we make sure that the skin still has hydration, that we're not overly drying it with harsh astringents, but we want to once again make sure that we are keeping that good bacteria balance where it needs to be as well, and getting rid of the bad bacteria. We also want to make sure that we're clarifying the skin. With that, we want to remember that when we are dealing with acne is almost as a wound. There's a lesion on the skin, and therefore we need to make sure that we are healing it properly. And anything on the skin that needs to heal needs to have hydration. And that's where that oil water balance really comes into play, making sure that your clients do have that skin compliant hydration that helps to regulate that oil production, but still gives them just enough hydration with a water base that they have the ability to have those lesions heal properly. And with that, making sure obviously when those are healing properly, properly, we remember that the skin is going to be less red, less irritated, and less chance for pigmenting. And finally, we want to make sure that we're detoxifying, removing any of those unwanted dead skin cells that have come to the surface, as well as making sure that that follicular wall does not have an excess buildup of those corneocytes. We know that we have 20 to 30 layers of dead skin cells on top of our stratum corneum, but we also have 7 to 10 dead layers of skin within that follicular wall. And with that, once again, we want to make sure that we are removing all of those excessive dead skin cells so there doesn't have that buildup, creating that microcomedone and acne lesion. The way that Lira Clinical achieves a difference in the skin, and one of the biggest compliments that we receive as Lira Clinical representatives, is the fact that they absolutely love our new reformulated ice line. As our ice line was reformulated within 1 year, it began receiving accolades throughout the industry in regards to being the best of the best with those acne lines. And so we were so very excited with the technology that we were able to incorporate into our ice line to be able to offer you these fabulous results that you can maintain with your clients, keeping their skin healthy and happy. So with the difference, what makes that ice line, what makes the Lira Clinical difference when you are looking to manage your acne clients? The exclusive mass technology. This comes from Lira Clinical's Mastica, and you can see on the bottom right, well, kind of the middle bottom right, you can see a picture of that Mastica resin. We like to call it a teardrop of a tree, as it comes from the mastic tree, and you can see where it's almost like a sap that is going to come from that tree. It falls down and creates almost a teardrop of resin, and that is one of the many forms of Mastica that we utilize throughout the line. We also have our topical probiotics. This is where we specifically address that microbiome balance topically on the skin, making sure that we have that good bad bacteria balance. And those topical probiotics also work amazing and making sure that we are controlling that inflammation within the skin. Our healing peptide delivery system enables us to be able to offer those active agents such as salicylic acid, benzoyl peroxide, retinol. All of these items of ingredients are incorporated into the products, but making sure that there is less topical irritation and redness on the skin, and making sure that those active agents have the ability to penetrate into the skin, once again giving you those better results and having that clear, clarified skin. Lira Clinical is also very well known for our wonderful brightening properties and how we've incorporated all of those brightening properties throughout the entire line. With that, our ice line is no different, where we like to utilize botanicals that have those versatile properties of not just being antioxidant, anti-inflammatory, but they are also looking towards brightening the skin. With acne, the usual challenge is that initial redness on the skin, and if not properly addressed, can turn into pigmentation later. And this is where brightening the skin with acne can be so very important. Things like our Halidris I have a struggle with this one. Halidris silicosa, which is also known as North Atlantic sea oak, that you can see on the left-hand side of your screen. A wonderful and very potent antioxidant, anti-inflammatory, but also a beautiful skin brightener that also contains natural SPF. So these are some of the few wonderful ingredients that are incorporated throughout the actual ice line that give you the wonderful results that you see with Lira Clinical. So when we look at our acne solutions, what are some recommendations that we can offer and we can suggest to our clients in order for them to achieve the actual success that they want. Now, you can see on some of these slides coming up that here are some before and afters of acne correction, of acne management with Lira products, Lira treatments, and this is where they've achieved those before and after results that you can see are just absolutely wonderful. So what I have done is giving you guys a couple of, hopefully some of the challenging clients that come in regards to having acne, wanting it to be addressed, wanting it to be managed, and trying to get that home care program just right to enable them to achieve the success that they want to see. Here I have looked towards teenage acne. And if any of you have any questions, please by all means type those in and I will be happy to answer those. So as a general category, we have our teenage acne. This can range anywhere from grade 1 to grade 3. A lot of the times we know that with our younger clientele, dependent upon their hormonal activity, their stress levels, as well as their nutrition. When you're looking at those teenagers, that's where we can see obviously where they are growing with their and maturing with their hormonal activity. Maybe they are in high school or college, and those stress levels can definitely fluctuate dependent upon their academic studies as well as their extracurricular studies that they are involved with, as well as their nutrition. We all know that as a teenager, and maybe some of us on a personal level as well, did not eat the way that we exactly should have. A little more than normal fast food, or maybe we just flat out didn't have time for that food on a regular basis, and therefore sometimes unfortunately meals were skipped. And this is where all of those things together are going to come into play when we are looking towards our teenage acne. We know teenagers are busy. We know that they know everything and that they are invincible because they are teenagers, right? And so with that, we want to make sure that recommending that home care, they can do it easily. It's easy to use for them and it's simple. So they are not taking a long time. I know one of the challenges can a lot of the times be, I don't have time to do that, but they still want that clear skin. In regards to some of your female clients, a lot of the times instead of trying to work with that skincare, sometimes it can just be a matter of they try to cover it up with a little bit more, how can we say, more than normal makeup application. So with that, we want to make sure with our teenage acne that we are looking into all of those things as well as the client's lifestyle. iSal cleanser is a wonderful universal cleanser that the clients can use and can also remove their makeup. Biohydra C serum. Sometimes people kind of look at that one instead of saying, well, what about the ice balancing lotion? A lot of the times, a lot of your teenagers, unfortunately, do not drink the proper amount of water intake internally. And therefore, sometimes on average, that skin can be more oil dry, or because it is oil dry, they have a lot of superficial oil that you need to address. But if they help to balance out that water intake, that is where their acne starts to balance out and their skin starts to balance out. This is where a lot of the times that Biohydra C will work a little bit better for those clientele as giving them a little bit more hydration, and where your Biohydra C serum is an aloe vera base, it works very, very nicely. It's non-comedogenic and not going to initiate additional breakouts, but really help to balance out that hydration level within the skin without feeling overly heavy or greasy on their skin as well. SPF of choice, I always recommend with your acne clients, whatever they like to use the best is what they should be using with their SPF. So whether it's the oil-free, the classic tint, or a BB, these are the SPFs that you can go through with them and decide this is the one that's going to work best for me, and that's the one that they should use. The Ice Clear stick is super convenient in the fact that they can have one at home, they can have one in their purse, they can have one in their locker, in their backpack, what have you. So if they do start to feel a breakout coming on, they have the ability to treat it immediately. Unscrewing the cap and addressing a specific area on the face that they have targeted with more breakouts. Usually a lot of the times this is where you can see it around the perioral area as well as along the jawline. This is where that Ice Clear stick really works nicely. And of course, when we are addressing our at-home treatment therapy, pro anti-aging pads, so easy for that younger clientele to utilize. Take it out of the actual jar and they can apply it all over the face 2 to 3 times weekly. Usually your anti-aging pad is not going to be a nightly application, but they can use every other night when they have that. Let's take a look. There we go. So our next client category is going to be our adult arrest acne. This is where your client is struggling with a lot of those open and closed comedones. We're looking at grades 2 to 3. This is where you can see a lot of that studded lesions, open and closed along the cheek and the jawline area. This sebaceous activity within these clients is usually very off, where they are struggling either with just overabundance amounts of oil throughout the day, or it's where they have that unbalanced microbiome where they're very, very oil dry. And so once again, their skin's very dry, but that sebaceous activity is trying so hard to make up for that. And finally, with our stress levels, where you get that clientele that they have those extreme high stress levels. And this is where we can look towards and making sure that we are addressing that and unroofing a lot of those closed comedones. You can see that they can use their ice cell cleanser and also their ice balancing lotion. When we have that ice balancing lotion, this works very nicely with that hint of salicylic acid to really help to address that congestion that they can experience along their cheek area of the skin. SPF of choice, as well as that ice clarifying treatment. Now, your ice clarifying treatment, we know, has that benzoyl peroxide in it. Benzoyl peroxide, we want to remember, with that 5%, that will actually it can have a potential to bleach some linen. So we want to remember to remind our clients of that as well. This is a product that your clients can utilize as a nightly application. Maybe they start with every other night and work up to a nightly application. If they are a higher grade 3, this can be utilized as a twice daily application underneath their SPF. And so that's where that ice clarifying treatment works so beautifully as a wonderful management product that however severe your client's acne condition is, that they can use that actual product more frequently. And finally, with those pro anti-aging pads, if you're struggling with a client with adult arrest acne, chances are that they are starting obviously that aging process as well. And this is where, once again, those pro anti-aging pads work fabulous to help to address the brightening of the skin, age management, but also is combating and targeting their acne condition as well. So when we are looking at a morning versus an evening routine, when we are looking at our adult arrest acne, if our client is struggling with more inflammatory acne lesions, we can use our Sal cleanser. They can use the clarifying treatment during the day, finishing with their SPF. Then as an evening routine, they can use their Sal cleanser, their clarifying treatment, and their balancing lotion in the evening. Now, if dependent, like I said, obviously on the severity of their lesion count, as well as non-inflammatory versus inflammatory lesions, this is where you can decide if they do need that. The ice clarifying treatment does need to be applied twice daily. If they have never been on a benzoyl peroxide product before, that's where sometimes working them up to a twice daily application works a little bit better, so their skin isn't so shocked into having it twice daily. Starting it as a nightly routine and then working up to twice daily does work very nicely. Now, if for whatever reason your client it may be allergic or hypersensitive to benzoyl peroxide, this is where you can switch out the ice clarifying treatment for the Pro C4 retinol serum, and that can address their acne as well. So next we have our environmental acne. This is a lot of the times going to be, once again, your older clientele. They can have that grade 1 to grade 3 and are experiencing that high stress load. A lot of the times these can be your clients that have a high stress job. With that, with a very busy schedule comes unbalanced nutrition. They could very well have been on synthetic hormone use prior. Now they have stopped. A lot of the times this can happen with your female clientele that have been on some form of birth control for a while and now have stopped, whether they're looking towards having a family or they're no longer using that type of synthetic hormone use. And this is where it can, once again, initiate that acne activity. A lot of the times your environmental acne is combined with a pigment condition. And so we do definitely want to make sure that we, once again, are addressing that pigment as well. With your environmental acne, a lot of the times they do need a little bit more of a boost when we are cleansing the skin, and therefore look to your client to see if the ice cell cleanser or the ice clarifying scrub is going to be a better choice for them by way of cleansing the skin. Where they have that unbalanced nutrition and that high stress load, this is where we've found that sometimes the Mystique Illuminating Beauty Oil works very, very nicely to help balance out that sebaceous activity. Because it is a dry oil, it's not going to feel greasy or heavy on the skin, but the properties of the brightening, the anti-inflammatory, and the healing aspects of our beauty oil works beautifully for that environmental acne condition. Of course, using their SPF of choice and targeting those specific areas that they are having those breakouts, that ice clear stick once again can work very, very nicely. This a lot of the times is going to be your client too that maybe is not eliminating on a daily basis. They don't have the water intake that they should. And unfortunately, that body is not able to release those toxins naturally on a daily basis. And many times you can see that congestion and breakout on their forehead. And finally, we have our Pro Anti-Aging Pads. Once again, using it anywhere from 2 to 3 times nightly. 2 to 3 times a week nightly. Oh my goodness, tongue twisters this morning. It's Monday. That's where we have that environmental acne, and it works beautifully with those anti-aging pads. So when we look at our environmental acne, what you can think about is you can use your clarifying scrub during the day, followed by the beauty oil if needed, and the SPF of choice. Now, if the client is experiencing an active acne breakout, they can use that ice clear stick within those specific areas. Ice cell cleanser in the evening, Obviously, your ice clear stick on those specific areas, finishing up with that beauty oil works very, very nicely, and a very simplistic home care routine that your clients can use. And then we have our active acne scars. These are our clients that are still experiencing active breakouts on a regular basis, but have struggled with their acne for a long time. This is where those clients where you see them and they've tried everything under the sun to try to get their acne under control and are willing to try. They're usually and almost always a lot more compliant with their home care routines unless they start to have some unusual breakouts. That's where occasionally they will result back to those random trial and errors that they can experience. So very important to help establish that trusting relationship between client and esthetician, making sure that you can help them through their time in managing their acne. You can see on the left-hand side of the screen a beautiful before and after of active acne and scarring that they have cleared up so beautifully. I believe that this came from Lira esthetician up in Northern California, up in the Sacramento area, and a beautiful before and after that you can see. They have those active acne lesions many times with inflammatory as well as that scarring. And because of the scarring and the continued active acne, a lot of the times these are the clients can experience a little bit more of that hypersensitivity on the skin. So we do want to be a little bit more careful and making sure that we are addressing the redness in the skin as well. Ice Cell Cleanser for these clients usually works a little bit nicer. Once again, with that hypersensitivity, keeping in mind that the scrub sometimes is a little bit too intense for them, and we don't want to agitate if they have multiple inflammatory lesions. Ice balancing lotion is one that, dependent if they are on that oil dry side, that we want to be careful to make sure that we're still balancing out that skin so it can heal properly. So if they need that additional hydration, put the balancing lotion and then the SPF during the day. If they're struggling with an excess production of sebum or oil, then we can flip-flop that ice balancing lotion for that ice clarifying treatment and use it twice daily. In the evening, we're looking towards Ice Cell Cleanser, clarifying treatment, and finishing off with that balancing lotion. Our ice refining mask works very, very nicely with clients with the active acne as well as those acne scars, looking to help alleviate a lot of that additional dead skin cell buildup that many times that they have, that we want to make sure that we get that removed. That ice refining mask can be used 2 to 3 times a week. Keeping in mind that the client can also use it as a spot treatment overnight, and they can also put a very thin layer on the skin overnight and sleep in it. And this is where it really helps nicely to help remove that excess dead skin, but the beautiful charcoal content within that mask can help to lift up and remove a lot of the toxins that have been retained within that skin. So when we look at, and we've talked about 2 of our 3-step solution success with our acne clients that they are using at home. When we have those things, we look towards, once again, a daily home care program that works for them. We are also using that in-home treatment. We talked about using either the Pro anti-aging pads or the ice refining mask. When we look at our in-clinic visits, this is where with acne, it's so very important that our clients stay consistent with that every 4 to 6 week window. Some of the different year-round treatment options that you can offer to your clientele that do cater more towards the acne side of skin is going to be our Crystal Complexion, Clear Brilliance, Coastal Clarity, as well as our Crystal Clear treatments. All 4 of these protocols are in a PDF for you on the right-hand side of your screen that you can download and utilize as a reference. Our crystal complexion is actually in our flawless guide for this season, combining that cell pulp with the ice refining mask. Now, keep in mind with all of these actual treatments and these hybrid treatments where we're combining different products, that you, the esthetician, are the artisan. You are the mixologist. You are the one that is going to decide, okay, am I going to put a lot of cell pulp or just a couple of drops? What is the activity level that I want to achieve with my client? The more of the actual resurfacing solution, that peeling solution that you apply to the other product, the more active that actual treatment is going to become. And so that is where we are going to look towards and remember when we are combining products, how active we want it on the skin. We also have our Clear Brilliance, which the primary mask is going to be the cell pulp combined with the balancing lotion. This was extremely popular in the fall when it was released with our Beauty Around the World guide. We also have our Coastal Clarity, which is actually one of my favorites, where we are utilizing, instead of the Primer Plus, we are actually using the ice refining mask as more of a detox step, then performing the Vitabright, and instead of using the polisher, we're using the clarifying scrub, which works very, very nicely. And then finally, we have our Crystal Clear. Our Crystal Clear is combining, once again, our Vitabright, but we are using the clarifying treatment and not using a mechanical exfoliator with that. If you have one of those clients that is struggling with a lot of inflammatory lesions, this a lot of the times will help calm that inflammation and calm that redness down without overtaking those things. So we have those, once again, those 4 in-clinic treatment protocols that you can look towards with using with a lot of your different acne clients. Some fun little tips and tricks that you can use within your actual treatment room, or you can use and suggest to your clients at home. Using the ice refining mask with the Mystique illuminating polisher is a beautiful combination that you can use as a pre-extraction mask. So combining equal parts of both, so you have that using just ever so slightly light steam, not hot, but we always want to use cool steam. Works beautifully to unroof. If you have those stubborn blackheads in the T-zone, this combination works very, very nicely. Post-extraction, if you do have those clients that struggle with redness regardless, this is where applying the Pro Light Serum and the Mystique lifting mask over the top, I have found beautiful results just to calm that skin down so wonderfully with as well as tightening the skin. So once you remove that Mystique lifting mask with a cool barber towel, the skin just looks so refreshed, ever so brightened, and without any redness residual from the extraction process. One of my other favorite tips that I like to utilize is with high frequency. Applying that balancing lotion with the healing peptide delivery system and then applying your high frequency really helps to stimulate that healing process after an actual treatment. Whether you need to do a little bit of sparking on those specific lesions that can be problematic on the skin, or using it all over, high frequency for me has been very successful, that I have really utilized throughout the years for acne clients. And we did talk a little bit about, by way of our home care that you could suggest for your clients, is that using just a very thin layer of ice refining mask and applying it to the skin, and the client can sleep in it, has the ability to really remove a lot of that excess surface oil and help to balance everything out. So once they remove it in the morning, then they can apply those hydrators, SPFs, and they have, once again, a nice clean surface without any excess surface oil. And finally, we want to look at cooling and calming the skin. One of the cheapest, easiest things that our clients can do to help with the redness and inflammation when they are struggling with acne is encouraging your clients to apply an ice application nightly to their skin. Once they've cleansed the skin, as simple as it is to take out an ice cube out of the freezer and rubbing it across their face for about 20 to 30 seconds really helps to alleviate and reduce that redness on the skin. They don't want to use an ice cube. They want to just apply a cool pack. This is something that doesn't take very much time, but really can make a difference when the client is struggling with that inflammation. Using ice, obviously, hopefully, is extremely affordable for those clients. It's a wonderful natural anti-inflammatory, and it also helps to reduce that skin redness. So I'd like to thank everyone for joining us today. If anyone has any further questions, I am happy to answer those for you in regards to treatments or home care. Do we have any questions, or did we get them all answered? All right, so let's just keep in mind once again that if you need to review any of the items addressed, that we have those available in the recorded link that you can find on our webinar channel, or the link will be emailed to you tomorrow morning. I hope everyone had a wonderful Easter weekend and have a fabulous spring day. Take care.